to order. And again, for anybody listening, this is the Mental Health Advisory Board, and it is the Behavioral Health Standing Committee of the Board of Health, and as I said, Mental Health Advisory Board, which gives advisement to the Board of Health. So welcome everybody, and thank you for being here on a Friday morning. Hannah we need to call the roll, right? Okay, is anybody prepared to do that? Do you want to do that, Amy or Jeff?
Sure.
Yep. Corey Tello.
Yes.
Chief Rick Weissner.
Gabby Bonte.
Dan Deneen.
Dan's here. Mary Campbell.
Here.
Martha Dittmer. Sharon Fitzer. Faye Freeman Smith. Trisha Mawat. Is Trisha with us? Chief Brian Moore.
I'm here.
Dr. Christine Strauss. Lori Walrab.
Here.
And Trisha did text. She is with us. She's just working on her audio for the Mental Health Advisory Board. And so we do have a quorum. So just a reminder, we want to get the minutes approved for the Mental Health Advisory Board at the beginning before discussion to make sure those can get approved. And for the Behavioral Health Policy and Funding Committee, Judy Buchanan. Anna.
Here.
Carla Pohl.
Here.
Susan Schaefer.
Here.
Corey Tello.
Some people please mute their mic.
Okay. Is that it, Amy? Okay, thank you. All right, so do I have an approval? Do I have a motion to approve the minutes from the Mental Health Advisory? Why don't I find them right now? What's the date on that, Amy? I got them right here. On the July 17th Mental Health Advisory Board minutes. Do I have a motion to approve those?
So moved.
And Dan, so Lori and Dan, thank you. It's been moved and seconded. All those, or any discussion? Okay, all those in favor of approving the minutes, say aye.
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 Or raise hand, whichever.
Only have to do an individual vote on them.
Okay, okay. So let's go around then again for Mental Health Advisory Board for approving the minutes.
Corey.
Yes. Aye.
Mary Campbell. Brian Moore.
Aye.
And I think that's it. Dan and Lori moved it. So I think that's it.
Did you get Gabby?
Oh, nope, I didn't. Gabby Bonte.
Aye.
Thanks.
Okay, it's been so I guess that's everybody. Okay, so the minutes are approved. Thank you. Okay.
Corey, I'm sorry. Before we get started, real quick, can we also just, as far as like housekeeping, before anyone talks, just to help with taking minutes, if you can just say your name before you talk, especially when Jeff has to listen back, that just helps him to know who was speaking.
Very good. And do you want to introduce Taylor? Would you like to introduce Taylor, Amy?
Sure. And just a reminder to stay muted also if you're not speaking. So Taylor Davis is our new behavioral health support specialist. So she is just helping move things forward. And so her background is she's a licensed social worker. And so she has experience working as a supervisor in case management, and then also in providing direct services. And so she's already amazing and already doing tons of things to help like move things forward. So I'm just very, very grateful to have her. And so yeah, our behavioral health team right now is just amazing. We're like, it's so much nicer having a team instead of just me.
It's a very good thing, and it's a perfect timing, and looking forward to all the good things that can be done. And Taylor, welcome. And Jeff, again, thank you too. And we should mention that Taylor has worked at both the Center for Human Services and at Bridgeway. So she, really knows the local landscape for behavioral health too. So that's great. Okay. Hannah, did you want to make any opening remarks?
Just real briefly, welcome to everybody. I'm glad we could do this as a joint meeting. I think what we talked about last time, and just, we have this money that we had allocated for 2020, and just hope that we can come up with today with something that will really put it to good use in this calendar year, or at least even start something that might begin this year and then continue through the next. So with that, Corey, I'll turn it over to you.
Okay. All right. We've got lots to get done. We really need your brains and your good experiences and expertise. So I'm so glad this is a good representation. As Hannah said, since June of 2019, when the Mental Health Advisory Board kind of said we should do some marketing. I think I'll give Dan Deneen credit for that wonderful recommendation, that we clearly are not getting to some of the people who are most in need and to get behavioral health services and supports. So it became, the decision came from the Mental Health Advisory Board to the Board of Health to say, we should think about a marketing campaign. We've been dancing around the edges of that since June of 2019, obviously delayed by the pandemic, but it is way overdue. And so I'm so happy that maybe today we will have some very concrete things ready to go to move us to a true implementation of that great concept. So we know that the people, those that with the greatest needs, the ones that have borne the greatest negative impact of both the pandemic and social injustice, are ones that we just are not always getting to the services they need. And the opportunities to get help and to access resources and to just really truly have a support network around them to get them through all times, but particularly these very hard times, which are going to go on, as we know, for some time more. So by the end of this meeting, the hope is that, or the end of this particular discussion, the hope is that there will be a work group formed that Amy and her team will be leading, and the work group will be moving us into an implementation plan, a real plan with goals and outcomes. And what you got, and I hope you all opened all of your materials, because I was tired of us dancing around the edges. And so I said, I'm going to put something to paper and you all can now play with it and help flesh it out. But the idea is, I looked at 3 different peer support programs, thinking that marketing to these marginalized groups would be best served by having the information come to them from their peers, that they're going to have a lot more trust. It's going to be, those peers are going to have a lot more understanding about what the resistance might be, what the barriers might be. So the idea is to start looking at this through marketing by peers to different targeted communities and populations. So I looked at 3 different support programs, and none of these are necessarily, purely for marketing, of course, but I wanted to just get an idea of what that looks like. And we know from for many years, there's been a lot of evidence base around the use of peers, that it really does result in people feeling more supported, more likely to follow through on goals they set for themselves, more likely to not need hospitalization, because it really does create an ongoing social network for them. And the idea being that the peers, help them develop more of their own natural supports, so that the peers do not have to be there forever. That this is kind of, again, the real goal of a peer program is that eventually those supports can be pulled away, because natural supports will then be in place. So Mary Campbell had sent me some information that the NAMI, National Alliance of Mental Illness, runs. It's a peer-to-peer support. So I looked at that, and they offer a lot of training, and that's a very robust program, which I'm not going to go into great detail. I'm just letting you know some things I researched to make sure that we have an evidence base behind this concept. And then a psychology professor at the University of Colorado, I believe his name is Charles B. Knight. He started a resilience coaches idea, which is a peer, which again offers support and then referral services. And that one directly came out of the pandemic, because they were seeing so many people right after the pandemic hit that were having so many mental health crises. And so he came up with this idea, and they did this whole, they blanketed many parts of the state of Colorado with these volunteer resilience coaches that they train. So that's another model. So again, that's out of the University of Colorado at Colorado Springs. And then Mental Health America has a peer coaching that's called It's My Life, self-directed care. And it is all about, it combines peer support with psychiatric rehab, and it comes up with an integrated skill and support strategies. And it really does help people build networks and friends and intimate relationships. And it also has a whole training program to train organizations on how to implement. So some of these models if we buy into them, there's training materials and everything that we could look more deeply into. But and again, we're going to have to do something that fits McLean County, but these are a great start. So before I continue to babble, anybody have any questions about any of that? Yeah, Lori.
Thank you, Corey, and thank you for all the hard work you obviously put into this document. There's quite a lot of great steps in here. Probably just for my benefit, because perhaps everybody else is aware, but I was curious before we get into the depths of the strategy that you've outlined, if we could maybe talk about, or you could tell me, what our overarching message is going to be as part of this campaign. That would be helpful. Thank you.
And anybody can jump in on this. I think and that's what I'm thinking. This is almost, to me, I always think of things in levels and tiers, because I think we start one way and then it can go deeper. And I think our initial, and again, please, this is all of you helping us make sure that this makes sense. My first thought is, because we said marketing, I think the idea is to develop some peers in the communities in different spots that are connected to different populations and neighborhoods and communities. And we develop them first just to be neighbors, to be ambassadors, liaisons. And the first goal of this project, I think, would just be to make sure that they can have a way to deliver a message about, we've got all these services out here, and if you're feeling this, you might plug into this particular service. If you're having this kind of an issue, you might plug into this kind of a service. And so kind of lay out some different strands of service, and then kind of attach it to what that person or people might be experiencing that would let them know this might be a good fit for you. So it's kind of having people that help their neighbors find a good fit for whatever their need might be. And I'm even thinking, and obviously our issue is behavioral health. So this could be, behavioral health. But I think right now we would all agree that behavioral health and economic crises and employment crises and housing crises and food crises are so linked that I think, we could kind of marry those supports beyond just behavioral health. But clearly, for us and our mission, the goal is to make sure they know how to access services if they're feeling afraid, if they're feeling anxious, if they're feeling depressed, if they're feeling suicidal. We want to help them, have these people help say, here's what is available, and here's why it's safe for you to go there, and here's why. And again, if it could be people with lived experience that could say, I've used these services and they were they made a huge difference for me. Okay, so anybody else weigh in? Go ahead, Hannah.
Yeah, this is Hannah. And just you right at the end, you kind of answered, I think, a question I had. To use the word peer, I think we need to be clear who we are defining as peers. And I think there's been some thought as issues with the pandemic has unfolded that this seems to follow more demographic, people of color or, who have less access to health care, but they would not necessarily be peers in the sense that they have also been clients of or provided mental health care. So are we talking about something more on a demographic basis of a peer group, with the plus being people who also have had some shared experience? Or are you talking more about people who have had exposure to and involvement with the system of services for mental health treatment?
And I would throw that out for anybody, because again, I want you all to help figure out what's best. My feeling is we probably need them to be both, but I think what I've been reading about why some people of color don't go to therapists, for example, is because they just feel like the therapists they don't look like, they say they don't look like me, they haven't lived my experience, they don't understand, some of the subtle, racist things that happen day in and day out that begin to beat you down. And so I almost feel that, maybe as we start, we look for both, but if we can't find people with both, I think it's important that we start with people that look like, and live in the areas of the people that we're trying to target, so that they really understand. Okay. All right, Susan, go ahead.
I'm kind of wondering, along with that, with some of the other programs the health department has, is be able to include that in somewhat like WIC and, the Better Birth Outcomes, because a lot of that population that you're talking about is involved in some of those programs. And so I guess that maybe that's another place that those relationships already exist. And we can start maybe there and then build on that relationship with what you're talking about with more peers kind of thing, or peers that are in that group, and look to that, the people that are being served by those programs that, can help find either peers or be the peers.
Thank you. Love that idea. And, Head Start for years has had a parents group that helps, give feedback into the Head Start program and how it can help better fit the needs for their kids. And so that would be another population I think we could tap into. Western Avenue has, some people I think we could tap into. I always forget the name of it. West Side, what is it? The West Side.
Building Revitalization Project.
Thank you. Write that down. Thank you. And so again, what I feel so good about is this group is such a good representation that you all can tell us more. And so if anybody, this would be a good time to popcorn if you've got other ideas to add to Susan's as far as who might become people we could tap to become neighborhood ambassadors or whatever we're going to call them.
Corey,
Go ahead.
this is Tricia. And what you were talking about, knowing that individuals sometimes don't go to therapy either because the therapist doesn't have similar experience or doesn't look like them. The National Council on Behavioral Health actually just sent out an article identifying just that and highlighted a jurisdiction that had received some grant funding to start projects and initiatives really to reach people of color. And one of the initiatives was through hairdressers and barbers, knowing that people often kind of vent to the people that are doing their hair, and that for communities of color, they also tend to go to people in the neighborhood and also individuals who also are representative of their race and ethnicity. And so and they're also in those communities usually, and they're involved. And the other one was going the faith-based route. And so I think those are some areas or some other individuals that we could make sure that we tap into to connect with folks.
Love it. Thank you. What was the second group you mentioned? Hairdressers and barbers, and then what else did you say?
Faith-based community.
Okay. Yeah. Yes, Hannah.
I think all great ideas right now. When Corey and I talked about this, and I kind of want to keep bringing it back to this, is that we have this money already appropriated for our budget for this year. And it seemed the best way to use that would be to do something that would be basically owned by the health department, at least at this point in time. So I think we want to look at structure a little bit. I mean, I think from what Corey says, maybe we do something where we would use this money to offer trainings and to pull. I mean, it'd be interesting to bring any of those groups or representatives. It would give us a chance to see how it works. If we could get some of those barbers or hairdressers or faith leaders involved. And, as you said, there are some training programs available. And, it'd be great to then look towards applying for some of those funds that you mentioned, Tricia, in the next year. But I really think, we're under such with such a crisis going on and some critical needs here that we really want to look at actually using these monies in some very direct way this year. It may be that we would not house it at the health department as we develop it, but I just wanted to bring that up as we talk about. There's a difference, I think, in looking at the target groups if we want to do a peer program and how we implement it.
Yeah, I don't see full 25,000 going to peer groups, a portion of it. I think right now we got the nice publicity on Tricia's program, the new triage program. And I think we need to keep building on that. And I'd like to see at least $5,000 be used on advertisements, web page, maybe even develop a web page or something else on what to do. But the first aspect right now would be just something catchy like got the COVID blues, or do the COVID blues, or something else got you down now, in please contact so-and-so and leave a phone number, or give a website page we can go to or something, just to get it out there, because we're going to get more and more people over the winter who get the COVID blues as money's running out and other problems come about, because I don't see things lightening up for another 6 to 9 months here.
Thank you, Dan. I agree. And that's why I keep talking about, I think we really have to think about this in levels. And, we start with some things that, like you said, low hanging fruit that we can do like almost immediately. And then we just keep building on it. Cause I do see this as having some really, if it comes to full fruition, we could be doing some amazing peer-to-peer support systems for that take us, way beyond that, almost are like life coach kind of people. But we're going to start with, like you're saying, let's just get the word out, and let's get some trusted people that are saying the right things to the right people. So Dan is right. We need to identify where do we start, and the start could be, and I know Hannah's been talking about some big billboards and all of that. And also, who else can we get to like drive this message throughout? So one of the things we have to do, and you did get in your packet goals topics, and one of those I put with number 6 was identify marketing promotional messaging. So we do have to have an overall theme, and then we have to stay aligned, because if you really do have to have your talking points, and everybody's got to be using the same talking points, because that's how you drive it into the public's consciousness, is if they hear and see the same thing over and over and over again, and the same language is being used. So we've got to figure out. Now, I do know that United Way, and some of you may remember, United Way right at the start of this and started something that they called, it was something about having trouble coping. and they put it on buses and things like that. And but that was like the 211 campaign. They were really encouraging people to use 211, but they did have like a coping thing. And then there was a group of multiple agencies involved with that, but then it kind of, like so many things, it kind of got frozen with the pandemic. So go ahead, Judy.
Oh, thank you. No, I like the idea of doing that short-term, low-hanging fruit, because we have the money allocated. Let's do something now, and I think the work group could be very helpful going forward. But right now, the notion of the awareness and billboards and buses and other things is excellent. We're going to have to come up with that short message that kind of captures person's attention. But we also, who are we going to have them contact? We haven't talked about that. So if you've got that, you're having the blues, we know how you feel, call or contact, whatever. So I think we need to think about that, so that it is something that they could identify with and they would in fact do some follow-up with. Calling an agency or something like that is probably not where we want to go. So I'd like to see some conversation about how do we get them, after they see that their awareness is heightened, how do we get them to take action then, to contact who?
Thank you, Judy. Yes, Mary.
Yeah, I follow up on Judy's comment. The systems are overloaded from what I've heard already. So to send them to, like, I've known people trying to get family members into the Center for Human Services, and unless you're in pretty dire straits, there's just no opening. And that's the reality of the situation. So we don't want to create a situation where people are out seeking help and there's no help, because they won't go back the next time. So we have to have the structure in place before we put the word out, I think. We have to know what we want the end thing to be before we say, oh, let's get help. I'm pretty sure that it's a requirement of the law for licensure that hairdressers have to go through training for domestic violence. I'm pretty sure it's in there. So it might be a way we could look at how we could, how we could add something into other people's requirements, or just even look at the training they get, the length of time, the structure of it, and make that available to others who might be willing to some people don't want to deal with the issue of mental illness. And so if it's not required, they're not going to do it. But who out there would be willing to take a 2-hour Zoom training that might be useful to them? Everybody's, pretty much able to do Zoom now. So that might be an avenue. If we have the pieces together, that then the hairdresser can say, call this, or reach out to them, or whatever. And in terms of marketing, there's a lot of marketing that's out there that's free now through a lot of tentacles that are out in our community, and they often get to the individuals we're wanting to get to. So sometimes a big splash is okay, but sometimes it really doesn't reach those individuals most vulnerable. I think just, for example, of our community from the Congo, how do we get to them? Well, like a lot of things are being put in bags, in grocery bags, in people's languages now, through the groceries that are given out through the schools. So like we were trying to advertise Dreams Are Possible's new class. Well, we can't go around and post flyers. We can't go, you barely go to a laundromat and post a flyer about the new classes. But by going through the agencies, and then they can put the flyers in the bags, and they can put the flyers at their window, there's alternative ways now that we find that don't cost anything, or very little, that get the word to the people who might be most in need. And I would think like resources of talking to people to get us started, the local group that's involved with the National Alliance for the Mentally Ill, maybe the local group that's involved with AA or Al-Anon, or some of those who might be able to be hands, let's say boots on the ground kind of people who could give us some local resources that would, just for example, the folks who are the sponsors in the AA program and in the Al-Anon programs, they are basically peer-to-peer support for everything. So they have a system that they've created. Now, of course, it's around alcoholism or addiction, but really, we all know that mental illness is a component of that in most cases. So I just think there's a number of, if we brainstorm, you get that committee together and you brainstorm, we're going to have a lot of resources out there to tap into. Thank you.
Excellent points. Thank you. Judy.
Yeah, really, to follow up on that, very good, Mary. In fact, that was, I was thinking, in addition to the awareness, and then where do we direct them? Who are we going to have a target audience? Is this just going to be across the board, or are we really targeting, and from the public health perspective, those communities and those individuals we know to have disparity and inequity in the services that they need? So that, I think that deciding on that target will also guide how we put this together and what groups, as Mary is suggesting, we might go to, because they're, I suspect, are the people in those groups that we really want to reach.
Go ahead, Lori.
Yeah, I'd like to go back to for a minute from the comment that maybe Mary made about recurrently identified resources are really stretched right now. So I wondered if we couldn't brainstorm about possibilities of expanding that. And I don't know licensing or what's allowed under law per se on some of these things, but if our licensed folks are overwhelmed and our agencies are overwhelmed, it is, and in beyond a 2-hour Zoom training that we might give to people like hairdressers who are already aware of these problems or such, but is there any option for students in social work or nursing programs, advanced levels of nursing programs, to take on some of this? Would they be interested? Would they be allowed? And what other people? Because I mean, like someone said, we can't, if we're going to send them to people who are already overwhelmed, that's not going to do anybody any good.
Thank you, Lori. Excellent. Everybody's making excellent points. Tricia, who's the MCBH? Is that Tricia that's lit up?
Yes.
Are you trying to say something? Please go ahead.
No, I wasn't. I've actually been muted, but I think because I'm on by phone.
Oh, you're showing your green. Okay.
Yeah, I think that's why.
All right. Well, just blurt out anytime you want to talk. So I think all of these points are really good. And but what's interesting to me is I have asked both Center for Human Services and and Chestnut if they are like full, and they both have told me they have openings. They are both, and like Chestnut, if you've noticed, Chestnut is continuing to run all sorts of ads saying we're here for you, we're open. So that's interesting, Mary, that you're telling me CHS is telling you they're turning people away. So I think one of the first things we're going to have to do is, reach out and find out exactly the state of fullness of each of our, basic behavioral health agencies, because I'm getting some real mixed messaging. And I mean, I keep checking all the time. Okay, go ahead. Go ahead, Judy.
I was just going to mention that, in fact, a personal observation, both with CHS and Chestnut, individuals that were seeking help for a specific issue, Chestnut in one case and CHS in the other were not able to help them. CHS then articulated who the priority patients or clients are going to be, and this individual didn't fit that category. So I think, again, we need to be careful, because both of those agencies, yes, are available, but for very specific types of.
Okay, and then we're back to, I was just going to say, and then we're back to what Susan's been saying. Go ahead, Susan.
Well, and that's it. It's that a lot of this is not necessarily in need of a psychiatrist and medication. It's counseling and that kind of thing, and helping to direct to the right resources for whatever those needs are that are causing stress and anxiety and mental health issues. So to have CHS like they've done in the past, those are the most severely mentally ill clients, where a lot of the population that we're talking about, whether it's, people of color or not, it's that they don't need that intensive type of, I think that that's where what we're looking at, trying to target is not the intensive, severely mentally ill. It's the coping strategies that we need to have, and the direction and as to how to reduce anxiety and things like that now. And I think that that's where I was going with the WIC stuff, because those people are connected in that way. So correct me if I'm wrong.
No, I think you're onto something. Carla, did you want to say something?
Well, I think one of the problems that we're going to continue to have in terms of bottlenecks is that when you have someone with a mental health issue, they have to be evaluated. And the laws are pretty clear about who can and can't do evaluations. Even advanced nurse practitioners are limited in what they can do in a mental health situation.
Okay, good to keep in mind. Okay, I'm going to do 2 responses and then again want you to come in. So in response to what Susan was saying, I do think there is a whole new group of people that have never felt this level of anxiety and depression before in their life. And so there is definitely a new targeted population that we need to speak to. They are not the ones that are in some of them not in the direst straits. And so you're right, they may be the ones that are being turned away from some of the agencies. So we do need to figure out what to do about that. I will say, I don't know how many of you, Doug Lamb is a retired professor at Illinois State University in the psychology department. And he has come up with this idea he's on the board of the Center for Human Services. And he is proposing that the center staff get trained, and he's going to do it because he's got some expertise in this, in grief and loss and that kind of thing, and anxiety related to all of that. And so he's wanting all the center staff to be trained in that, and that then they could run some community groups on those topics, just on an ongoing basis. And they were at first thinking in person. Now, obviously, I think they've got to think maybe some in person, but obviously some by Zoom or whatever. So they are waiting. They have a potential funder for that too, and they're waiting to hear. And I think there's a meeting coming up like early first week in October, and so they should know then. But they're kind of poised to, if they get the funding, to run with that. And so that would be, and again, by group, which I love, they could reach a lot more people faster. So that might help take care of some of those people that are experiencing things very much as a result of COVID. So that'll be good to know about. And then back to the student thing. I think it is always, Lori, a fabulous idea to try to use those students, because that's such a win-win. It gets them wonderful experience. It also gets us, really low cost supports with supervision from very qualified people. I do know, like I'm right now working with the school psych department, using their graduate students, thinking about using their graduate students to do something that's going to support school districts. And the university, the school psych department has been very, they're very willing and already have kind of said, yes, that's a good fit for our students. So there's certainly many other departments. There's clinical psychology, there would be just counseling, there would be social work. So yes, we could certainly reach out to other university and nurses. But Carla's right, there's always, first of all, there has to be supervision lined up. And there's a cost to that, and time for the faculty and all of that. So, it's not, so again, that all has to be fleshed out. But I think the university, I know I was told by them that President Dietz had issued several months ago, when he was in front of all of his department leaders across the university, he said, this is the time when we must step up and be supports to our community. So I know they're very much encouraging the university to do things for the community. So that's definitely a resource. Okay, so go ahead, Lori.
Thank you, Corey. So beyond mental health, though, we're also talking about people who need some sort of economic or financial help, and a wide variety of issues have sprouted up since this began, and of course, even before it began. So I'm wondering, are we, I know we have a mental health triage center, I'm well aware of that, but it would seem to me that we would need some kind of a funnel where what we could promote to people is go to this one point. I know we have a no wrong door philosophy, but maybe what we're looking for is here's where you can get help, and then that help, and I don't know whether it's PATH or more appropriately something else, but PATH comes to my mind. And then that center can direct to, help those people find what they need. And maybe that's what we're trying to promote here. There is, in my mind, I'm thinking, yes, there is help for you, some message along those lines. If people don't know, they're just home struggling. Maybe you're an elderly person and you're struggling, you're alone, or whatever it is, even if it's help with school, a school situation, how to get what you need, resources for that.
Yes. Go ahead, Mary.
I just wanted to add to the list of possible students is Heartland Community College has a 2-year nursing program. And for the most part, the students who come there, almost all of them are from our community, whereas the students at ISU tend to come from outside the area. And because it's a lower cost education, a lot of times the students in those programs come from the community that we're trying to reach. So I would want to add those to our list of possible areas if we're looking at doing some training of them, of the student population, to be a resource.
Awesome. Thank you. First of all, let me just say, I am loving this discussion. You all are, oh my gosh, these are such rich, wonderful ideas. So, and I'm trying to think about themes as we go through it for the work group. But right now, I just want to keep moving. I want to keep getting what's coming into your brains. I love the Central Resource Center, Central Resource, whatever we're going to call that. That is PATH, that is 211. But I think you're right. We've got to maybe make it seem just so user friendly and so welcoming to capture that. So I think that's one of our first thing. Our overall marketing theme, what the message is, the global message is going to be, is one thing we have to do. The other is, what is that central resource that we're going to be saying, this is where you start, the starting point. And then the other thing we must do is really get a good sense from every entity that's got supports available, like what is your current availability, and then and then identifying all the other, but then I think, and that's like the more formalized behavioral health piece. But I think what, Mary, you're bringing us back to is, so we need to know who the formal players are that can be referred to. But then I think, Mary, you're suggesting that there's this whole group of informal supporter providers that we do some training with. And at the very least, they can be, are you kind of thinking of them as they would be like, for lack of a better word, they would be that first, they'd be like throwing the lifeline out. And so at least you can grab this lifeline to get started while you might be waiting for something more formal. Or even the lifeline people could kind of help start directing more in a more targeted way to, this might be the resource for you. Is that what you're thinking, Mary?
Yeah, and I as you were talking, I was envisioning our community, and I was thinking about the fact that, we have large pockets of people in congregate housing. We have multiple senior citizen centers, and we have multiple family units. And there are staff in those programs who, some of them have, good training in a variety of areas, I'm sure, but an additional level of training might be really useful. I know, I used to know, they used to be my students, but now they've retired. So like at the Bloomington Housing Authority. So they tend to hire people, or at least did hire people with a social work background or psychology background or something in that area. But they're right there. They get the word pretty quickly from a neighbor who says Sally's not doing well, and then they're the ones who go in and check on Kathy, you know, or Sally or whoever. And so I think, you know, I don't know how much specific training those individuals might have had, but I think they have the foundation, and then some additional training might be then if we knew what to tell them, that they could then tell those persons as to how to get the help. I think we've bridged one level of we've gone across the bridge a little bit and been able to be of help. And I was also wondering whether, like, and I haven't called PATH in a really long time, but when you call in, do you, like when you call these other places, it's like push 1 if you want Spanish, push 2 if you want Congolese, push 3 if you want, you know, Philippine, whatever. Do we have that in our resources where people can get it the first line in with their own language? I don't know. Just curious.
Yeah, that's a great question. I'm not sure of that. Thank you, Mary. Great idea. And, you know, PATH does the training, you know, PATH offers training for, like, I know when I was in the school system, you know, anytime we would hire a new school psychologist or new social worker, we sent them off to that day-long PATH training where they learn about every resource in the community. I know they're still doing that. So that would be very helpful to us, that if we're talking about doing this training for those people. And maybe they're already getting it, but, you know, we definitely need, I mean, there's a lot, it sounds like we definitely need to ask a lot of questions based on some of this great stuff you're bringing up.
And how kind of what if I recall from students going through the training is they learn a little bit about everything that's available, but I think we're a special niche. I mean, what we're talking about is how to help people get to the next level,
Right.
How to recognize some of the characteristics that might be present in a person who's elderly or a young person who may be using drugs. I mean, it's kind of like, how do we then direct them to the help that's available?
Yeah, go ahead, Judy.
Yeah, no, I'm listening. I don't know how many of you have been through the mental health first aid course, but a lot of what we're talking about is very similar. Those of us who are, you know, not in the clinical field, we attend those courses, and the main objective is to prepare me for how to respond, not to do the counseling or anything, but how to respond to that. So I think we have an example of that, and hundreds of people have gone through that here in McLean County. So that's one thing. The other is the 211 number. And I think some of you have heard me say that before, having gone through presenting a variety of programs to our community where I was encouraging the use of 211. I was always taken back by how few people knew about it. And these were people who were in a position to be that listening voice. So if we do decide to go with something like 211, which is already established, we really need to have the kind of conversations Mary is suggesting. You know, how overwhelmed are they? If we're looking at getting people prepared to respond, where do we send them, and are they going to be able to take that call and direct them? Because I don't know. I think PATH has seen an increase, but where are they?
Most definitely. I've been getting those numbers, and some of those have been shared, and they definitely are seeing an increase. And every month. Initially in April, I think it went down because people were afraid to do anything, but then it's been going up every month since then for the number of calls they're getting. And what they and the crisis team are telling us is the calls are increasing, but more critical is that the acuity, severity of the problems are much greater than they used to be. And as Megan Mosier is like beating the drum, sounding the alarm, saying that so many more of the people they're seeing now are requiring hospitalization. And they just were not doing that, because they do such a good job of trying to deflect people from hospitalization by hooking them up with supports. And I think she's saying that they're running more almost at a 50-50, that about 50% of the crisis calls they're taking are now having to be some level of hospitalization, and that's just not what they've seen. So acuity is a huge issue.
Well, and if you talk to our state's attorney or folks in that office, you will find that they are seeing an increase of domestic battery, and there are a much higher number of individuals in our county detention center who have been the batterer. So there are just any number of people we can go to and find out who these specific groups are that need to be made aware.
Okay, so I'm going to, anybody else have this is all fabulously wonderful. You are the best. So any other things that we need to really make sure we put into this mix of promotional development? Go ahead, Hannah.
This is Hannah. And I think one of the things that always happens, we all understand the problem really well. I'm going to kind of go back to what Dan said in terms of, I'm going to bring us down out of the stratosphere a bit. We've got, $25,000 to work with. We're not going to be able to address all the problems. So I would really like us to think about, and it's hard for everybody in this meeting to sort of say, okay, I just want to focus on this one or two issues, knowing that there's millions out there and many we can't solve. But it would be really great if we could find some very targeted, very concrete program to put these dollars toward this year. And, we've run the gamut, and, maybe it's data collection and really getting a handle on who those people are out there we have anecdotal, I think, evidence and feelings about it, but do we know which pockets of the community are really in the greatest need? I don't know. I guess I'm advocating for, as we move forward, to really come up with something very specific that we can build on in the next year, but at least get something done starting this year.
Well, and Hannah, that's exactly why, I'll let you go first, Mary, and then I'll say that we need to move into identifying the work group, because I think what we have to do, we can't in this meeting nail the specifics, and that's why I gave us an outline that I want us to start looking at in a minute here. But Mary, go ahead and make your point.
Well, Judy brought up the mental health training, the 101, the one that's for youth and one's for adults.
Right.
And I took the class too, Judy, and that's been my field, and I learned a lot of things that I didn't know. So that's a very interesting, already created program. I tried to get my intern this semester to get into the class. I had her call right away, but it was already filled up. So it's possible that for a small amount of money, we might be able to expand their reach into the community by offering more classes. I know originally they got funded, and so people didn't have to pay to go through it. It was, I don't remember, United Way, somebody funded them, and so it was free. I don't know if that's still the case, but I do know that it's an excellent training program. It's already available. Maybe it needs to be offered to some of our church members, our church leaders. We have some really great ones who really are out there in the community. Maybe it needs to be offered in specific targeted groups or something, hairdressers, I don't know. But maybe we already have a training component that could be used, maybe not in total, but maybe part of it. So
Mary, I think that's a great idea. And I just spoke with Maureen Solers the other day about mental health first aid, because I've been very worried that it's not been going forward because of the pandemic, and where they're stuck right now. And first of all, Mount Pisgah, I hooked them up with Mount Pisgah because I want them to do a training at Mount Pisgah. And they were working with, because Mount Pisgah actually even has a behavioral health liaison. They've got all sorts of task forces and stuff. And so anyway, I think they're working to get that done. But to get to the point, because of the pandemic, and because it was going to be difficult to train a lot of people at one time because of social distancing. So mental health first aid, as the organization, the national organization, created some training that could be done remotely. They were really reluctant to do that at first because they're very rigid in how it has to be delivered. And they finally came up with remote model. And then they came up with a hybrid where some of it's remote and some of it's in person. And, but the problem is they want to retrain all the trainers, and they want to charge for retraining all the trainers to do it remotely or hybrid. And that costs a lot of money. And, you know, this community has a lot of people trained to train it. And, so Maureen is very frustrated because it seems like they're more worried about making a buck than getting it delivered. And they've also upped if things are delivered remotely, then they charge $29 per person for the materials versus $10 if it's done in person, and they can give you a book. Now that makes no sense to me because it would seem to me a hard copy would be more expensive, but that's kind of the game they're playing. So Maureen has been stuck with trying to figure out how to navigate around these increased costs and retrain the trainers to be able to do it remotely. And there are people, I mean, I think you would all agree, you know, people that still would be very reluctant to come to an in-person training with a bunch of other people. So that if we're going to go that route, I think you're right. We're going to have to say, maybe we allocate some monies to helping pay to retrain some of the trainers to do it remotely and all of that kind of stuff. So that's a whole nother thing. So that is why I'm going to bring us back to a work group, because I think what we need is a small number of people who, and I would like to suggest that this will be a fast moving work group so that when we do this, we will concentrate it and, you know, probably meet for some longer periods of time with the idea of really trying to accomplish things very quickly. And so we have a concrete plan ready for implementation within, I'd love to say, a month. And that's going to take some investigation. I mean, that's what I'm hearing today. We've got investigation to do. We've got partners to bring on board. We've got, cost factors to, weigh out, all of those things. And so I think that would be best done during a work group. And so I'm now going to turn you to the document you got in the packet that says marketing promotion plan.
Hey, Corey, could I interrupt
Yeah.
for a moment, please?
Sure.
This is Hannah. And I guess I had not heard this about the mental health first aid training till now. I don't know if others were aware of that or not. And Mary, I think the health department with the mental health money paid for a lot of that training when it first came out. I know we had allocated, maybe not last year, but the year before, money for doing that. I don't know if it's exactly the same, but, you know, I guess I'm feeling, again, I understand the need for a work group for developing some big term plans, but by the time we get this done, we'll be through this fiscal year, was my concern. So if we can come up with a way, and maybe this is a way to use some of this money now and get the work group going as well, Corey. I think that's
sure.
a good idea, but maybe this is exactly what we needed to hear and to know that we could significantly help if we can retrain. And I don't know what dollars they're talking about to do that. But you know, if we have this money that we didn't allocate, that we have appropriated and not spent, and there's an absolute immediate need that we could use, then maybe we ought to be going down, looking at that as an option for the 25,000. I don't know if it's more than that.
Well, that's what we have to investigate, Hannah, because it's, like I said, that you got to retrain the trainers, plus you have to pay for the materials for each participant. So I believe that when we paid for it before, we have taken it out of fund balance when the health department allocated some money to, and basically what I believe we paid for was materials. We paid for the $10 per person materials so that the people could get it free. So they would not have to pay $10 for materials.
Well, and maybe this is two different things, but I would like to think that as we are looking at this critical need for people to understand mental health issues and help people get needs, and this program, I have not taken it. I meant to. It's one of those things I never did, but I've heard very good reports on it that, you know, if it's kind of dead in the water now, we need to really make sure that it's not. And if
I agree, but I still think it's bigger than to offer a training though, Hannah. I think it's still, because if we're going to identify key people in the neighborhoods that are then going to have that knowledge and then know how to use it, I almost feel like after the mental health first aid training, we need to have a second round of training where we really empower those people to use it in a much more robust way than just saying, okay, now I know how to do this. But the idea still is we've got to get it to the people that we are wanting to use our services and get help in a timely fashion, so it doesn't get acute. So I really feel like anything we do has to be, like, it's not a one and done is not going to do it. And so I totally agree with you. We could immediately get mental health first aid reenacted or paid for, but we still have to figure out, after those people are trained, how are we going to be able to employ them in a very robust way? Okay, go ahead.
You betcha. And that's all I was saying, is that if we have some money now that's there, we don't have to, then maybe this was the best way to use that immediate funds, with the understanding that we are supporting that with the second step, which is absolutely important, that we either get the right people trained with it once it's up and running again, and/or.
That's my point, is we just don't want to open it up to the community, because we've been doing that for a long time. We want to be really targeted in who we invite to this. Yeah, go ahead, Judy.
It sounds like we still need to get the program, the people retrained. So if we could do that now.
Yes, thank you. Okay, Mary, did you want to say something? And then Judy.
Within each community, there are helpers. There are already existing people who can be identified. Like I used the example of the senior high rise. There are within those communities people who are already the unpaid, untrained helpers, and every community, the Western Avenue could identify some people who within the Hispanic community. I mean, there are people who are just social workers out of who they are. They care and they want to help. And I mean, if we could get the training specifically to individuals like that, then they take that training back to their own community, and they become a person in the neighborhood who can be a resource. So, I think Hannah's idea of maybe using some of the funding to get this back up and going is very relevant. And then maybe what we do is we work with the small pockets in our community, and we identify within them, or they identify for us, individuals, and then we reach out to those individuals and try to get them into those trainings. And maybe there's a stipend for them to go to it, because generally they aren't people of any means. So not only is it free, but there's a stipend attached. I mean, there's ways to get that out into the community, because the normal systems are already in place if we can find them.
Mm-hmm, mm-hmm.
Judy, did you want to say something?
Not in addition to that. That's where I was going. I think if we look hard enough, we're going to find that person in each organization, whether it's a faith-based community. I mean, we just have such a myriad of organizations, and we already have this model of mental health first aid. So I'm fearful that 25,000 probably is just going to not do it, but then we have to go out and find a few more dollars to do it, because I believe as part of the incentive to get these helpers, as Mary is describing, to a mental health first aid, will be providing the mechanism where they don't have to be charged. And that's what the public health department did. And it was a good chunk of money, but I think we've hit on something here that might be realistic and actionable. So I would hope we move in this direction.
And I will say there are other organizations involved. There's a team of organizations that run the mental health first aid training, and it's like, is it Carl? Now I got to remember what the name of the new hospital is. It Carl? So Carl Chestnut, Public Health, and I think there's one other entity, and so they all have helped pay for some of it too. So again, we need to bring that group needs to come together and figure out what they need from all of us. But I don't think we have to be the only funders, because I know those other big players help fund it too. Lori, did you want to say something?
Yes, thank you. I've not been through that training myself either, and so I don't know what the content is. But so let me ask: does that involve being able to get people to other resources beyond, or this is a critical when somebody's in a crisis? My understanding is when somebody's in a crisis. No. So
No.
if someone presents with a deep financial problem, like a rent problem or whatever, it's able to help that situation.
Lori, to answer your question, this is Amy. To answer your question, it's on how to respond to someone that's in a mental health crisis. It's also just to help identify different mental health symptoms. So if you, versus the stigma that goes along with certain behaviors. So they use the term like algae on how to apply or on how to respond to people. But however, as far as like resources or kind of like what you were talking about, that's not the focus of it.
Thank you. So that brings me back to the broader problem with, there's a central location we could direct people to, or one of a few, where people who are in these other situations, because that is also a very critical ongoing need right now, that we could promote with some of this money. We could let these populations know through various means, if you are in need of help, go here, or click here, whatever it is. But beyond, and certainly the crisis, mental health crisis is very important, but there's so many, and we can't fill all those needs, but we maybe can be one of those helpers to direct people toward people who can fill those needs.
Go ahead, Judy.
And I think that we've talked about 211 while we haven't had conversations about what their capacity is at this point. We already have within our community an established mechanism for directing people rather than creating another one, because they take calls on housing. I don't feel good, or I feel like I'm going to hurt myself. They take calls on a range of things. And so we already have that mechanism, and that might be one that we could enrich with our assistance.
Because I'm sure that, as we said, that many people don't know, and it's not at the top of their mind, that 211 is out there, even if they do know about it, have heard about it somewhere in the past. Let me add that I wonder if we couldn't team up with the city and the town of Normal to use their text message system to let people know, if they would agree to that, if you need help, go X, because this is something I get, about garbage and sorts of things.
Love that. Love that. Thank you, Lori. I wrote that down. So just again to track, because we're at 10:10. So I want to make sure we walk away with a very clear plan of where we're going next. So I still think we want to put a work group together. And and Hannah, that is not delaying things. The work group, the first mission of the work group could be clearly nailing the central resource location, which could well be 211, and it could be identifying everything we need to know about funding mental health first aid, and it could be about the theme, what's going to be the theme that's going to be the overarching theme for this little campaign of ours. And we can say that's got to get done in 2 weeks, that's all got to be packaged and ready to go, that the mental health first aid thing is ready to go, the central resource place is ready to go, the messaging is ready to go. Then that work group also is going to have to identify who are all these people we're going to call to come and get the training and know the messaging and know the central location. And then, we start there. But I really feel like the longer term piece of that is after the training, those people have to become a network, and they have to have support too, because all my reading on these peer support, the peer-to-peers, is if you don't support the peers, then it falls apart. So in addition to training them, we then have to say, here's what we expect you to do after the training. And then we have to also build a support system for them, whether it's even some way that they're linked together so they can talk to each other on some sort of a regular basis and support each other, so that somebody is going to be checking in with them. So, that again, nothing can be one and done. That's the research clearly shows forget that. You think you're going to do some big hoo-ha, and it's useless if it's a one and done. So we got to build a system, and that's where that's why I feel the work group is critical, because it's going to help us build a system. So if you will go back to identifying, first of all, I had goals and topics for today's meeting. If you can find that sheet, it says goals, topics for today's meeting, and it's got 9 items.
And sorry, Corey, I just wanted to give a quick reminder to the group too, that we have sustainability, the 25,000 for sustainability to go over also.
Right. So I want to nail this. In the next 10 minutes, I want this nailed, and then we're going to move on to sustainability. So if everybody's got that in front of you, looking at number 1, we've done a great job on that. We've got lots of feedback. We've talked about now what, and again, I would say at this point, unless we've already identified some targeted communities, Mary did a great job of helping us do that, and others. So, but again, I think that's what the work group can continue to nail down, and then send out to all of you and make sure we haven't forgotten anybody. Then we've got to look at all potential partnerships. We've talked about schools, we've talked about barbershops and all of that. So that again would be, let's really nail that. I think in this marketing campaign, we've got to I love what you said, Lori, get the cities and the towns involved, and that can be the rural towns as well. We also want to get United, well, I said United Way already, but anybody that is also helping to do some of the central messaging needs to be there. And then all sorts of outreach methods. And again, you also got a list in your packet of everything that you suggested. It was called the marketing campaign ideas, and where it was just a bunch of bullets of all the different entities. So we've got those. I've added to that from things you said today. We'll redo that and send that back out. Love it, love it. And interesting, we did have hair salons and barbershops on that. So, but thank you so much for Trisha's good comment about that. That's huge. And churches, of course. And then we do need to do the theme. And then we've got to talk about locations and organizations to be involved. And I think now, instead of identifying locations and organizations, although we still can do that, we've now moved it to, we want to identify people that can be trained. So we're really identifying those key neighborhood liaisons, or agency or entity liaisons. And then we need a communication system for them so that they can stay connected and supported. And so I would like to say, and so again, that's just giving you an idea of what the work group's going to do. But the immediate thing, Hannah's point, let's get the mental health first aid lined up like ASAP, and let's that be the first couple things that the task force works on, work group, I'm going to call it. So would you maybe email me after this meeting, or well, let's just say show of hands, who would like to be on the work group? Knowing that we probably are going to meet pretty fast and furious for I would say 3 weeks. We'll try to meet, pretty quick in succession, so we don't lose momentum, so we don't lose our thinking, and really try to nail something. So, and then, there could be some people that say, I can't do that intensity right now, but I want to participate in some way. But if I just want you to know, if you're committing to this, you're going to commit to some pretty intense work for about 3 weeks. So do we want to do a show of hands? I don't know. So we have Mary.
This is Gabby Bontia. I'd like to be on it, but I won't be able to start next week. It'd have to be the week after.
Okay. So Gabby, Mary, anybody else? I'm going to do it.
This is Trisha, and I'm willing to be part of it also. But at the same time, if you want to, then I am happy to step back as well. So.
Okay. Judy, are you volunteering to be on it? Great. Okay.
Appreciate Judy.
I'm sorry, did somebody else say something? So right now we have Mary, Gabby, Trisha, and Judy. Did anybody else say anything? And myself? Okay. And Amy's group is going to kind of be in charge of probably, we'll all be working together and we'll have assignments. And I think this is going to be pretty intense. So and this is in the middle of everybody having 15 other intense things going on, but we can do some, and we will obviously meeting remotely. Is that what people are wanting to do? Okay. Now tell me, is this Open Meetings Act? This would be, right? Okay, so we'll have to always post it and do that. Okay, so we need, and that's 48 hours notice, right? Before a meeting.
Well,
Okay.
That's just for posting. That doesn't include the preparing to get everything together to post.
Okay. And I now purchased Doodle Poll, so I will send out, now can I do a Doodle Poll without having to, does that violate Open Meetings Act?
No, that doesn't violate
Okay.
Open, Corey, but it'd probably be easier for Jeff to do the doodle poll
Okay,
because.
okay, perfect.
Yeah,
Love it.
it's
Okay.
pretty busy. Yep.
I'm thrilled with that. Okay. All right, so that's where we will start. You will get a Doodle Poll and we will get something going very quickly. And the first meeting will lay out, a timeline, because I think that's going to be critical, so that we move this, because I share the urgency. I'm appalled that it's taken us this long to, like I said, we danced on the edges way too long. So thank you so much for all of your fabulous input today. Okay.
Yes, real quick. Should we include Maureen on this? Since she's the one.
Yes, for
the lead
the
on
first
the
part.
North
Yeah,
American.
for sure. Thank you.
Yeah, she's
Thank
the
you.
lead on it here.
And I would say too, I don't have a problem with people coming, like you're saying, inviting people for different meetings with different intent. So we may need to think a little more about, before we make the final invitations, we may have a couple other people that we need to invite because they have some very pertinent information related to what we're going to be talking about. So, okay. So any other comments for this before we move to sustainability? Awesome, awesome, awesome. I am feeling very good that we got a plan. Okay.
Can I
So
just
moving.
say, it's Mary, Corey.
Yes.
I'm kind of new, so, but I'm not hearing representation related to young adults, teens and young adults, and how to reach into that world, because the overdose rate and the suicide rate is so high that it's very scary. So
Yeah.
I think that's a population that I know, like, for example, there are certain groups, one through the Multicultural Leadership Program, Youth Global Citizens. They are trained to become servant leaders. And then there's the Not in Our Schools group that's
Yes.
trained to be peer-to-peer on discrimination and other things. And so there are some core young groups that are extremely active, that we may be able to get into them a little bit more.
Love it.
That's not to say that they are representative of the population we're trying to reach, but they may be able to lead us to them.
Thank you. I just heard a presentation from the Not in Our Schools students at the Phi Delta Kappa, whatever it is, Delta Kappa Gamma meeting. And oh my gosh, those kids are so articulate and passionate out. So that's a great suggestion. Thank you. Okay. All right. Any other groups that you can think of before we close this, any other groups that we might be missing? I think we've talked about seniors. We've obviously talked about people of color. We know we need to talk about the LGBTQ group for sure, because we know they're very impacted. But Not in Our Town could help with some of that too. And so any other groups besides young adults and the others we've mentioned? Okay, hearing none, we will move to sustainability. Okay, so in your packet, you had something that said draft sustainability plan. And that was the same thing on our June. In June, we said we were going to allocate $25,000 to a sustainability plan that was recommended, again, from the Mental Health Advisory Board to the Board of Health. And the allocation was approved for the 2020 budget. And again, we've kind of been put on hold because of the COVID, and it's time to move on this. So last time at our Mental Health Advisory Board meeting, some ideas came forth, and those are listed here. So we did say we need to, so again, maybe I should back up and say, let's make sure we all have the same understanding of what we're talking about when we're talking about sustainability. So I'm going to throw out a definition, and then I would love you all to add to it or help me flesh it out further. So I believe the goal, initial goal, was to say, we fund through 553 and 377, which is the dollars obviously allocated, tax dollars allocated for behavioral health and developmental disabilities. And we have funders that every year we fund. And the idea was always then it's very hard to bring in new, to bring in anybody that new that wants to come on board, because you have to almost X out somebody who's currently being funded in order to bring on new people, because there's never, we're always like this year we've got at least over $1 million difference between what we have available to pay and what is being requested. It's always at least $1 million difference. So we were thinking about how do we help our entities and agencies figure out other revenue streams and other ways to sustain their vital programs and services, so that it isn't always relying on us. Or if somebody new startup wants to do it, how can we ever make room for new things if we're always having to keep funding the existing things? So the idea was to help existing entities, and really anybody, really develop a robust, I'm using that word a lot today, but a robust sustainability plan, because often they say, well, we already have tried everything we know, and there's no money. The state's low on money, the feds are low on money. So they seem to be stuck so many times. So the idea was to figure out how to help them open pathways to different types of funding, new lines of business, whatever it might be. Okay, so that's a long-winded definition. Anybody else want to weigh in on what sustainability is? Okay, so we kind of all agree that that's kind of what we're after. Okay. All right, so take a look at those ideas then. So we talked one thing about and we've talked for a long time about blended funding. And we clearly know that for several years now, if you're applying for any kind of a grant, if you can show collaboration, that's almost an absolute priority to get funded anymore, to show that you're working with other entities. And so we've talked a lot about how can we get our funders together to streamline funding sometimes too. So, because we know when agencies are funded by multiple funders, it can be overwhelmingly laborious for them, because every funder usually has different things they have to track and different reporting systems. And so it just sometimes makes it very daunting to have to do everything, if they're getting 5 different funders, they've got to do 5 different things. And so we've often talked about, at least locally, could we bring funders together and see if we could even streamline what we're asking from our entities, so that they don't have to do everything 3 different ways. So, and then we also know all across the state, we've got 7 or 8 boards that we could tap into to see what are they doing to help their agencies become more sustainable. Can we learn from others? The same with any of you that are connected to professional associations, professional organizations. Lori, with your kind of human resource background, all of those things, like how can you tap into entities that we could also pick their brain for what they do to help promote sustainability in their area or arena. We also talked about getting a consultant that's their expertise, that could come in and work with us. And I do believe the county brought somebody in. Can anybody help remember who that was? They talked to all the agencies, and I'm sure that was driven by the county. Trish, I think that was before your time. And it was, it was a day-long training. I don't know.
And it was about billing or sustainability?
Yeah, it was kind of about just funding, like how to, yeah,
Okay.
how to make your funding be more diverse. And I think it was also about efficiencies in your systems and all that kind of stuff too.
I'm gonna
I'll
get
look it up.
Okay, I'm gonna guess it was before my time because
It
I
was.
don't know of anything since I've been here like that.
Yeah.
But I saw Lori's hand go up, so I wonder
Yeah,
if
go
she
ahead,
has more
Lori.
knowledge than I do.
I think I'm recalling what you're talking about, but of course I don't remember the name of the folks. Susan May, and she's not, I don't think she's on the call any longer. What I lost my train of thought. I in one of the community United Way webinars that I had attended, they had managed to get a single application form. Now, this was for individual people seeking assistance, but they managed to get a single one that would work across a variety of agencies.
Awesome. Yeah.
Which was awesome, yeah. And so I wondered if we couldn't maybe tap into that vein, the people they spoke to, or whatever it was they did, to do that, and maybe take it the step further of going from the individual to the organizations, and what you're talking about here in this piece. Maybe I think everybody would, hopefully that was valuable. I guess we should find out whether that's worked for them, and then, because if it doesn't work on that level, it's not probably likely to work on a more complicated level, I would imagine, that this is.
Thank you. I think that was for their housing initiative, wasn't it? And it looked like, it was amazing. It saved people from having to run around to different places and fill out different things. So thank you. That's a great example. Okay. And then I think it was you, Tricia, that mentioned healthcare financial services. Can you tell us more about that?
Well, in the past, one of the things that I know that I've brought up on this topic is bringing somebody in from the state to provide a training about best practices and essentially how to effectively bill for Medicaid and managed care plans through HFS, and how to make sure that you're capturing all of the services that you're providing so that you can bill for as many as possible, obviously without duplication, but the thought being to bring in somebody from HFS with the state.
Great idea. And do you know how easy that would be to do, and what kind, like how much time such a training might take, or would it be more of a over time it would happen, or it's like a one-shot kind of thing?
So my initial thought on that would be that I think there would be advantage to bringing someone in 2 different times. One, to address the agency serving youth, because some of their billing is a little bit different than the agencies serving adults. So I would probably do at least 2 different ones.
Okay.
How long the training would take, I don't know.
Okay.
But my thought with that one, when we first discussed this, was that providers in town may see the advantage of it being sort of that outside entity rather than another agency in town presenting a training.
Yeah, I think you're onto something. Okay.
Plus,
Okay.
they're also the ones that it goes through. So, they're the ones that know or should know.
Yeah, and they certainly have credibility, and that people would see, that would feel, I'm thinking every agency would feel like that was a very relevant thing. Yeah. So, okay, that might be a great place to start. And then somebody brought up Illinois Wesleyan's Action Research Center. Whoever, was that you, Mary? Can you tell us more about that?
In general, tell about that. It's Deborah Halpern is the coordinator, and Bevan Chobin, I think that's how, Bevan Chobin is the assistant or whatever, and they have pulled together I would say most every community organization, and they do a touch base of letting people know what's going on. They meet, I believe the funding used to come from State Farm. I think Pawnee Otten was the coordinator with that, and they would provide lunch. Well, of course, now you bring your own lunch to your Zoom, but they let, it's kind of like an update. One organization might be the presenter that day, and then about what they're doing and what their funding is and where they've gotten it and what they're doing and what they've lost, etc. And then everybody else has a chance to touch base. But in addition to that, the Action Research Center also has students who they then place with different organizations to do different projects. So there may be 3 or 4 students working on a project, maybe accessing all the research that's out there on topic A and putting it together in a final document. Anyway, it's a great resource. It's free. They're supervised by Deb, and so they get, Bevan is really a great person to work with. They both are, and they provide the supervision, and they try to tie it into their classes. So it's academic based in a way. And yeah, I don't know of anything quite like it at ISU or at Heartland. I think it's kind of unique.
Mhm.
How hard is it to get assigned to it?
You just, we contact either Deb or Bevan, and we say, would you add us to the list? And the next time something is sent out, our organization is on the list. I mean, it's that simple. And then if you want to be a presenter or you want to do something, then you could reach out to one of them and say, you know, next time there's an opening, we'd like to talk about what we're doing. That's it. Very,
Super.
very
Super.
easy.
Super. Thank you so much. That sounds like a great, that would help move us along really quickly.
Yeah.
Judy, you wanted to say
Get
something?
the word out to, I mean, it's kind of like a path directory in a sense, except it's personal. And they are able to get the word out through, like, almost all the organizations, agencies, and different groups have a person who's the point person who goes to those meetings, and then they can bring that back to their own organization.
Super. Thank you so much. That's a great resource. Judy, you wanted to say something?
Just in addition to Medicaid, because I think we do need to refresh a lot of places on how to bill, and they're not aware of some coding changes and things like that. So we probably could maximize our dollars there. The other thought I had, and this resource center may be a way to get it, is I've always admired Chestnut Health System's ability to tap so many different places. They get federal dollars, they get state dollars, they get grant dollars. I'm just always amazed at the various buckets that they pull from. I don't know how they do that, or would they be willing to share it? That's another question. But perhaps the research center could help us with that kind of a thing. If Chestnut's a member, have they presented? Because they have been phenomenally, I think, successful in tapping lots of other sources, particularly at the federal level.
Of course, what's helped is that drug use issues have become so huge with the opioid crisis and things that you know, that has been such a priority federally too. So anyway, but that's a great point. Okay, Hannah, you want to say something?
Thanks.
Yeah.
Thanks, Corey. You know, we had talked at different times about maybe hosting more of a clearinghouse on our county website, just so that, you know, maybe grant opportunities. Tricia mentioned something today. I don't know if all the agencies, I know there's different ways that you get alerts on those, and maybe not every agency is on those lists, so it might be another way of just letting people know. But my question is this, and I know that there's some money here that has been allocated for this, and I guess I'm not quite understanding where that fits into. And I think that all the ideas are great, but I don't think they cost really much, and I don't know if the training on the HFS folks would do it for free. I'm hoping as a government agency they would do that. So before we go too much further, are we anticipating devoting some of this money to sustainability programs? And if not, my suggestion would be that we consider moving that over to the other side of the table today and using it either to help with some of the mental health first aid costs or whatever. Just put that in that other pot to make 50,000 available for some of the programming we might do. So, because I'm just asking for some clarification on whether there was some dollars associated with these sustainability, and if not, whether there would be some interest from the group to put that money towards programming.
I think I helped to suggest this also. I don't
You
think
did,
there's
Dan.
anything fixed solid as far as the differing amounts. We recognize both needs, one to get the word out and the other one to make sure that once we get a program going to make them self-sustaining down the road, such as the school program, where one agency was very good at accessing Medicaid and other sources and the other one was not. We might not need the full 25,000, so eventually there could be a reallocation, but we just wanted to make sure that every agency was able to maximize the dollars from the outside parties, because that's part of our mission statement, or one of our goals was to establish these areas and then to push things to the side and then to make the programs more self-sustaining and to access outside sources, because instead of a $1 million budget to meet all the needs in the community, we need a $5 million budget. And so in the different areas, we need to find a way to have them access insurance, Medicaid, other sources.
Thanks, Dan. Yeah. And I think, Hannah, what we were thinking at the time is that if we did have to like bring in somebody like almost like a consultant to really learn that really had deep expertise in sustainability issues and all the different tentacles of that, there might be some money we would be paying to someone. And I don't know, I mean, Tricia and Mary, I mean, the research now, if we can get that done for free, that's a whole thing we no longer have to worry about. But I mean, I don't personally know if there are people that is their specialization. I can't imagine there's not, but we maybe need to investigate that a little bit, whether there wouldn't be any value to finding a consultant that could work with the agencies again on an ongoing basis. Because again, I think sometimes when you bring in one training and they get some information, and certainly the Medicaid, that's something we can do immediately. But on an ongoing basis, if we want them to start thinking differently and building their budgets differently and, building their strategic plan differently, that might take some ongoing consultation until they've turned that corner. And so that would be to me, that would be maybe the only cost we might have would be if we found somebody that really had some really good expertise to kind of come in and train and coach. And also, I don't know if we feel like do we feel like that would be anything that, would there be any money that we would have to pay the agencies for doing this? I mean, is there any cost on their part to have to, take some action steps that we maybe don't know about? And I'm throwing that out asking. So anybody have a reaction to that? Hannah, go ahead.
Well, I just want to point out, this money is in the 2020 budget. So we have from October to the end of December to spend it.
Although Amy, we found out we could move that over. I think Amy did. You check with legal, Amy, and that could be.
Well, let me just say, I know how the county budget works.
Yeah.
And we can budget it again for next year if we want to, certainly. I mean, that's what you mean by move it over. The county board hasn't approved that budget yet, and if we want to add dollars to that, then we can certainly do it. I mean, it's either spent or not this year.
Yeah.
So I guess in my sense, when I'm looking at this money that has already been, and it's not earmarked, I don't believe it as anything other than mental health right now. It's not So I recall when we discussed it last year, we didn't put dollars to specific programs for this money because we weren't sure what we wanted to do.
Right.
So I just say that if there are programs we want to get done or we can use it in a good way this year to address the problems we're facing now, that we do that. We could certainly opt to increase our budget for next year to do this again or more of it. But I mean, it's either appropriated or not in any given year. So this will come, if we move it, it becomes fund balance, and then we just use fund balance for that program for the next year.
And
So-
I, again, Hannah, I share your concern that, I mean, we should not be sitting on stuff right now because of the urgency, but I also want to make sure that anything we do is, you know, well thought out. And so it's not just something we throw at it and hope it sticks. We want to make sure it's evidence-based. Yeah, go ahead, Lori.
Absolutely.
I don't know whether it's feasible to conceptualize somebody who could be shared among some of the smaller agencies or housed, like you said, Hannah, I think you said there had been conversation at one point about posting grant opportunities someplace in a collective area, maybe through the county, have a small part of some position somewhere whose job it is to, and I don't know if that person could possibly even have the expertise to know all the resources, but to start looking and identifying and digging them out and, you know, really summarizing what the grant is about and, you know, what the qualifications are, so then people can, and posting a link to them and people could then research them themselves. I mean, maybe a 1/10 of a position or something.
Oh, I like that. And I think that would be helpful because you're right. We've got a couple agencies that are fabulous at that. And then others that I think don't, you know, they don't even know how to start. So I love that idea of having somebody that's their expertise. Now I know in Dan Brady's office, he used to have someone, her name was Jane. Does anybody know who that is? But her expertise was doing that. I mean, I guess she just really studied the grants and she was a great resource. And I don't know if she's still with him or whether she would, you know, whether she is somebody that could train somebody that would know that, because that was, I guess her job is she just scanned tons of different, you know, sites and places to find grants that might be appropriate for, you know, this area. So
Was
I
that
love
Jane? Was
What's
it
that?
Jane Chamberlain?
Yes.
Jane Chamberlain. She's still in town. She's not with Brady.
Okay.
I know she's active in Rotary. I hear her name there, but I'm not sure what she's doing. But it's Chamberlain. She was the director of the YWCA for a while too, before that.
Okay. But anyway, I love that idea, Lori, because I just think you're right. I think now, especially with budgets that they're going to be coming into 2021, I just think agencies, they're not going to have a lot of extra anything to, you know, pay for that. So if that could be something that we could, that a shared idea is an excellent idea.
So I was thinking, you know, of a position that already exists in the county, say, you know, and
Yeah.
putting dollars toward that rather than hiring somebody, because you can't hire somebody for a 1/10. It would be difficult, 1/10 of a time. Maybe you could get a quarter-time person, somebody who's retired, to do it. But anyway, somebody who already deals with this on a very light basis, maybe we could spend some money on it internally.
Tricia, do you have any thoughts on that? What Lori just said, like running that through the county, maybe?
I don't know who the person would be offhand. I mean,
Probably you, because let's face it, let's face it, everything runs through you in behavioral health.
I mean, maybe, and I guess if we ironed out the details of what exactly it would be in the allocation of time and, you know, I mean, maybe then, and maybe seeing it would help me. Yeah.
You know, or maybe the dollars in part go to a supervision of that or something, and then you hire that external person quarter time. I don't know if this would pay $25,000, you know, how long a period that would last for under those circumstances. But.
Okay, thank you. I'm looking at the time. We've got 13 minutes left and I want to make sure we have this nailed down too, because we've got to, so do we think we should also put in place a work group for sustainability too, so that we, again, make sure that we have a team that like really drives it to implementation? Or do we want to just parse this out and start with a couple of things and then meet again and identify some more things? So in other words, I guess I feel like we're building a system with our marketing. We're building a system with sustainability. I don't know if it's as much a system as it is just targeted activities. So you tell me, do you think there would be value in creating a short-term work group to just kind of nail the action items on this thing? Or do we want to just pick a couple of things and start and then do a couple more later? Go ahead, Lori.
Well, I think minimally we need a point person, whether that's just for the action items or for a group. So
yeah. Thank you. Any other comments? Susan, I think we've got our point person. Susan came on right when Lori said that. Hello, Susan, we have a job for you. So we're working on the sustainability plan. We've got, and so we kind of talked about for the marketing plan, we kind of came up with kind of really building a system, and we've got a work group that's going to lead that. But with the sustainability plan, we've identified some really important action steps that we could take like right away. One is getting connected to the Wesleyan's Action Research Center, so we get a couple of students to do some research for us. We've also talked about bringing in a training from the Healthcare Financial Services, training all the agencies on Medicare, making sure that our Medicaid billing that we could do fairly quickly. But we're also talking about, really trying to do more. Maybe also another big item was having a clearinghouse where we identify, all potential grants that that people in our community could jump onto that clearinghouse and always keep track of that. And then just the last thing we just came up with, which is great, was coming up with an idea for a shared function among multiple agencies where that there would be somebody that their job would be to search for grants in, very targeted, relevant grants. And that would be, they would then feed that information to multiple agencies. So no one agency so every agency isn't having to do that separately. And we talked about maybe running that through the county. Maybe that could be a part of somebody's position at the county where they do that. And then we just mentioned Jane Chamberlain because she used to work for Brady, and that was one of her big jobs when she worked for Dan Brady, was to identify all sorts of grants and shoot them out to people. So so the question is, do we have enough of items that we could just get started rather than create a work group, just identify a couple things and go? Or do we think we should do a work group for this too and flesh it out more, be more mindful about it and intentional about it, and would that keep it cleaner and better run if we have a work group that's guiding it? Any thoughts on that? And Lori suggested at the very least we need a point person that would be the point person for sustainability planning.
I don't have anything right off the top of my head after just walking right into that. So,
and I didn't mean to put you on the spot. I just was trying to catch you up too. I'll tell you what, I'm a kind of a believer in work groups, but maybe that's because I'm nuts. But I just think sometimes when you bring people together and you really, first of all, it makes you be accountable because you have to report to the whole group and you have to lead with this is what has been decided and next steps and all of that. So I almost wonder if we shouldn't, and maybe we won't even call it a work group. Maybe we'll just say let's have another meeting for sustainability for people that are really interested and just really nail it. But rather than make it a part of the mental health advisory board or the funding policy group meeting, have it separate meeting just to try to nail sustainability in a little bit more detail with some timelines. What do y'all think?
I'm for the work group for the reasons you cited, and I volunteer for that.
Thank you.
Assumption it's an eternal ongoing thing.
I agree, because that's, I mean, sustainability, we have to make sustainability sustainable.
Corey, Hannah.
Volunteer, Susan? Hannah?
No, I'm not in a position right now to volunteer for it.
Okay.
But I did like your idea about just devoting some of the future meetings to that. It is a long-term issue.
Yeah.
And there's lots of, I think we have to also make some policy decisions ourselves in terms of our grants. As
Right.
long as we make them available, you can say sustainability all you want, but
Right.
people will count on those monies coming year after year. And we are in kind of a box because we've made some commitments long-term over, whether we call them commitments or not. And
Right.
so I think we also need to address that piece in terms of our own funding policies as to how we would enforce some of that within our own programming or guidelines. So I think it's a big topic. I don't disagree. Work groups are great. Get a few people with some good brainstorming going, but
Right.
also I think it would be worth to have.
Yes, I agree. And I think you're right. That's a policy piece. Go ahead, Susan.
So since I just came in, maybe you can answer this question. Are you talking about sustainability on this marketing stuff? Are you talking about
No.
sustainability on behavioral health funding?
Yes, agencies having more expertise and commitment to building their own sustainability plans for their work. And so that it would become in their strategic plans and so they would have a very, intentional planned sustainability plan that, and that we would help them, we would do everything we could to help bring expertise to them in that process.
Oh, I'm just not going to go there.
Yeah. Okay, so anybody besides Lori interested in being on this? And Amy, did you want to say something?
Yeah, I just quickly wanted to say, I like what Hannah said because I was thinking we keep having a hard time like defining what sustainability means and what those expectations are. So maybe I agree with the work group and just starting the work group off like with what are those expectations of the Board of Health, defining sustainability, and then using resources to help move that expectation out to agencies.
Okay. So let's assume we're going to have a work group. Right now, Lori's the only one that's volunteered, so it's hard to be a work group of one. So is anybody else willing to be on the sustainability work group? Okay. So
I apologize. I'm just on so many other groups that I just don't.
I know. And that's the problem. That's the problem. So maybe let Lori, at the very least, how about if we make you the point person? Okay. For just this topic so that you'll keep making sure that the Mental Health Advisory Board, keeps moving this forward, that we keep.
Well, I do feel like I need to work with Amy or someone in
Right.
terms.
Oh, of course. Right.
I was going to say, it wouldn't like, Taylor and I would be part of that work group too. So Lori, maybe just the three of us can arrange a time to meet to talk about it.
That sounds good. Do you want, I'll let you put out a schedule because you're probably more tied up than I am.
Okay. And then, and again, that's basically the way we're now structuring it. That's going to be more advisement than that you'll bring back to the Board of Health. So that would be great. Okay. So any other comments before we have to approve minutes? And then, so this has been, oh my gosh, I am so impressed with this amazing group of people. We've hit a lot of things. Okay. So Hannah, I'm going to turn it over to you to do the minutes for the funding and policy.
We don't have those minutes yet. We'll take those to the funding and policy. And
I thought you said we had one more set of minutes to do. I don't know what I was.
no, just the one.
Oh, just the one. Okay. All right.
Okay, but I would like to, Corey, I would like to say something again, broken record here, but I don't feel like we have addressed yet how we might, I guess I feel a certain sense of urgency and programming those we have total of $50,000. And I agree. I think there's some big topics here that warrant careful consideration and planned programming, but I think there's a big need out there. And if we can put 50,000 this year to something, I would really like to see that happen. And I don't know if,
Well,
If I-
I think the mental health first aid thing, I think that will be like the very first thing that the work group for marketing does is look at the mental health first aid thing. So that will easily be allocation of dollars, like immediately when our first meeting, that will be coming out. And we can have a first meeting within a week.
okay. And I would just suggest that I think that we actually have 50,000 because we had 25,000 over on the sustainability side, which probably, from what I've heard, we don't necessarily anticipate spending this year. So if we have those funds and we could get that retooling of the mental health first aid done or contribute to it with the other partners, that would be great. So that's all I wanted to say.
Okay, so you're, I mean, is that something we have to vote on to say that because you're really saying move the money from one category to another, not necessarily the budget, but.
It's not, it's just in the budget as money right now. We never allocated it in the budget. I think there were
What do we need? I mean, but we had mental health advisory board members and board of health members that thought that money was earmarked for two different things. So does anybody besides us need to like kind of approve that change?
Well, I think
I'm
probably,
asking.
I don't know the answer to that. I mean, I don't think in the formal budget for the Board of Health, it's been specifically identified for one or the other. I think within the discussions, or maybe Amy, you know, and I don't know how it's exactly reflected in the budget.
Yeah, I can quickly, I have it pulled up from what was in the budget on it. And so I can quickly go over that. It was, the 22 budget proposed a transfer of the 50,000 from Fund 0109 to provide materials for mental health first aid classes, to collaborate with the Mental Health Advisory Board to fund financial advocacy and community trainings. So Hannah, I think you're right. And then it was kind of thought of, there is like a subtext to that it would be the suggestions of trying to do the 25-25, but as far as like where it's in on the fund balance, it was transferred to the same fund. So it's on Fund 0109. But if you also want me to check in with the finance department to make sure, so it sounds like that money is in the same place. So the money is together in the same place.
And do we want to give the sustainability money away before the sustainability group has even met? I mean, I just am wondering if they want to at least have a moment to think about how it could be used conceivably. And my other thing, Hannah, is transparency, because I sometimes don't want us to bypass the entire Board of Health with like doing stuff without letting them know we're changing some things. So just a thought. I'm not disagreeing with your proposal at all, because I would rather we use the money, to make something happen right now. But I also just don't want to feel like we no longer are acting on behalf of all Board of Health members.
No, and if we have a meeting in October, a Board of Health meeting, I would anticipate it being brought to the board in October.
Okay,
I think with your timeline on the other.
Okay. Carla's saying yes. Okay.
I just say that it's hard, from what we've discussed here, it's hard for me to see how the sustainability group or plan would use the full $25,000 in this fiscal year yet. So it seems like at least a chunk of it could move over without detriment to what's on the paper here, at least.
Okay. Super. Okay. Unless we talked about that function, unless there's some sort of a function that somebody's going to do to create a clearinghouse, a website clearinghouse. And I mean, is that something that could be done? And would that require paying somebody to help create that website, and or paying a function within a budget so that different organizations could get told about grants?
Well, I think the
Would
time
those be cost factors?
paying for a website development separate from what the county has. And if we're paying somebody to do that work, by the time, they might be doing it for 1 month in this fiscal year. So little of the money would be used.
So should we, maybe we keep 5,000 for sustainability and move the rest of it?
Well, I guess I don't think you really know yet how much you need to spend out of the other portion, the other,
Right, exactly.
why don't we see what you need and just let's talk
Okay.
about it when you see what the need is.
Okay, all right. So we definitely need to, the work group for marketing definitely needs to meet before the board meeting, which is fine. We can make that happen. Yeah, okay. Okay, 11:03. You all are fabulous. I don't know about you, my head is swimming. I can't wait to read these minutes because, and I implore whoever is writing the minutes to try to make them as detailed as you can because there was so much wonderful information. Please try to capture all of it so we don't lose these this great input. And I took notes and I'll try to do that too. Okay, thank you all. Have a great weekend. And I feel really positive about really trying to reach some people and doing it, having a plan that really will guide us for a system. And I think that's what we always have to think about. You got to build a system. So we're off. Thank you.
Don't forget to adjourn, motion to adjourn.
Okay, and do we have to, okay,
Yep,
do I
yep.
hear a motion to adjourn? Somebody
I
raise
move
their,
we-
okay, so Lori, Mary, okay. So all in favor, say aye.
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 You don't have to go around on that one, do we? Okay, good. All right, thank
All
you,
right,
everybody. I think we are
Thanks,
adjourned.
everybody.
Thank you.
Corey, are we staying on or no? Okay, no.